5-Minute Pearls for Clinical Practice. Today's pearl is called perseverance. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. In the next 3 podcast episodes, I would like to discuss 3 of the elements that are crucial in terms of the attitude that we need to bring to patient care. I call these the Holy Trinity of how we should present ourselves to patients, and we will cover each of these 3 attitudes over the next 3 podcast episodes. As I've mentioned before, I am a huge fan of music. Recently, I heard an interview with singer-songwriter Neil Finn. You may remember him from bands such as Crowded House and Split Enz. The interviewer asked Mr. Finn, who has been writing songs for about 30 years, what his secret is for writing great songs. His answer surprised me. Neil Finn did not talk about music theory. He did not speak about how melodies flow together. He did not speak about sophisticated understandings of chord progression. His answer was very simple, but also very profound. He said that his secret for songwriting, if there is one, is perseverance. He said that the main reason that he has written hundreds of good songs over the years is that he persists with his work. He spoke about how he needs to sit for long periods of time, and eventually his creative juices start to flow and songs begin to come together. He plugs away in a consistent and focused manner, and eventually songs fall at his feet. No pun intended, as Fall at Your Feet is one of his best-known songs. Neil Finn brings patience and perseverance to the art of songwriting. Likewise, there is an art to taking care of patients, and endurance is one very important component. You may have a patient who still smokes 2 packs of cigarettes a day, even though you've told him to stop smoking dozens of times. You may have another patient who is still eating fast food several times a day, even though you've reviewed the basics of nutrition with him many, many times. One of the most important key attitudes for us to maintain as clinicians is to persist in our effort and in our message to patients. We have to have the endurance and the persistence to continue to offer each of our patients the best possible care time and again. Patients change and grow at their own pace, and change sometimes has more to do with other factors outside of our control. As clinicians, what we can control is the message that we convey to patients. It is pivotal that we stay on message with patients even if they don't always follow our recommendations. Even when patients fall off track, stay focused on your message of good health. Just as good song ideas come to musicians who have the necessary endurance and persistence, healthy habits will eventually come to your patients when you find the endurance and the perseverance to continue to present messages of hope and healthy outcomes. This week's pearl is perseverance in clinical practice. Next week, we will discuss the second key attitude to have with patients. Let's keep the dialogue going. Let me know what you think of this week's pearl for clinical practice, perseverance. Post your comments and your experiences on the 5-Minute MD Facebook page. Follow us on Twitter at Brian Morris MD. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. And of course, you can visit us anytime at 5minutemd.com. Let your friends and your colleagues know about the podcast. If you subscribe to our podcast on iTunes, you will receive new Podcast Pearl episodes as soon as they are posted. Thank you so much for listening. This is Dr. Brian Morris. I will see you at the next 5.